Hi, so I'm Kylene Smartis. I am your president of ARAS, and I am very, very happy to introduce Dr. Karen Brazel. Probably pronounced that wrong. I am so sorry. She is the vice president of American Board of Surgery, and Hatel Rich. Sorry. I tried. She is the project manager over at the American Board of Surgery, and they're here to give us a little bit of information about the EPAs and working with the CCC on our committees. So,
thank you, Kylene, and thanks to ARAS for giving us this opportunity. Hopefully, the webinar isn't the greatest format for question and answer, but I have left quite a bit of time to respond to questions. We also will have time. I will be at Surgical Education Week the entire week. So part of this is putting my face out there we want, Hethel wants, the board wants feedback and your ideas, your successes, your triumphs, your struggles with both implementing EPAs writ large, but also now that we are starting to get a little bit of momentum and have some data that will help you with your programs and hopefully help you make CCC discussions more efficient. But we definitely want feedback. I am the vice president of the ABS and also was a program director for 10 years at a very large program. So I do understand the struggles and the work. I like to start with the ABS mission just to kind of center us the EPAs are about assessment. So when you look at our mission to serve patient, society, and our specialty, rigorous evaluation assessment, EPAs really fit squarely there. And some of the work that we have seen come out of the early data show that the fact that EPAs are based on a defined set of behaviors that everybody has access to make them more equitable, and that the evaluation process at least has the opportunity to become more equitable. I can tell you some of the CCC discussions that I was part of tended or could tend to be colored by a faculty member's last interaction with a resident that might or might not have been reflective of that resident's performance over the entirety of the last 6 months or so. And then the vision, and hopefully we can all agree that we want to unify our efforts in pursuit of excellence. So I'm going to put up a screenshot of our current platform. And if you go to the top here, this is the dashboards of our app or our EPA platform that is hosted by Simple. And if you go all the way to the right, that is the CCC report. And that gives you a suggested milestone. So as you start getting ready for your CCCs, this gives a suggested milestone for a particular resident that is listed up here in the top. And this happens to be milestone PC1, and the suggested milestone rating is 4. Right now, that suggested milestone is based on information that is that comes from the previous 6 months, but it is more heavily weighted to evaluations that have been completed more recently. We found a few bugs in this equation, or in this the analytics that go into this. And so occasionally you will see a milestone rating of 5. And given that these milestones are these suggested milestones are supposed to be solely based on EPAs, and we don't have 5 levels of EPAs, we are fixing that. But for right now, if you see a suggested milestone rating of 5, please consider that to be a suggested milestone rating of 4. There is not a one-to-one relationship of EPAs with milestones. And so there are other things that you will likely want to consider when you are putting information together for your CCCs, and also in guiding the discussion. For instance, if a resident doesn't show up on time, that's not captured in any of the EPAs. If a resident is abrupt and or is difficult to find when work is to be done, that doesn't show up in any of the EPAs. So we are not here to suggest that the EPA is the answer, but hopefully providing this suggested milestone rating. And there is a question in the chat. The site, you have to sign in to the ABS app, and from an administrative standpoint, and that should get you, if you have administrative access, that should get you to these dashboards and over to the CCC. If you are having trouble doing that, I'm probably not going to be able to get you there on this webinar, but please email epas@absurgery.org, epas@absurgery.org, and we will get you there. And this suggested confidence level tells you how much confidence the algorithm or the analysis has in making that assignment. So the way I explain that is if the confidence is 78%, that's pretty good. If the confidence rating is 12%, that's not so good. And if, as a suggestion, you might open the discussion at the CCC. We have a suggested milestone, but it's not based on much information. Does anybody else have other information that can contribute to this? And yes, we will eventually be able to run the CCC report for all milestones without clicking on each individual one. I know that is a hassle, and I know that makes more work up front, either to then export them to another file or to run them off. That is, you can't do it yet. So don't waste your time trying. It will just frustrate you. That is either number 1 or number 2 on our list of things to make happen, because we know this going back and forth increases your work. Have heard that loud and clear. So we are working, this is, I guess, version 1, although I will tell you it's more like version 4 or 5, but it's version 1 wide release. And there are 2 things that we are working to fix: the bugs in the algorithm that give you a suggested milestone of 5, which can't happen based on the EPAs. And sometimes you'll get a suggested milestone of 1 or 2 when all of the EPA ratings are 3. And you're like, well, that doesn't make much sense. So there are a few bugs in the algorithm, and we are actively working on those. And then the second one is to be able to do a bulk download. So thank you for the feedback that you have already provided on that. That is very important. And I do say we're working on it a lot. This has been a very large undertaking, and there are a lot of things we are uncovering. But that is one of the things that we are actively working on. The other thing that I will tell you, each of the EPAs is mapped to milestones, the ACGME milestones. And so, and it's mapped to several, somewhere between 6 and 8. So when and if you look at the free text or the feedback that has been given, the feedback may not have anything to do with the milestone. For instance, if I have completed an EPA, which I still do when I work with the residents, and I give them feedback about their technical to communication, patient care, and systems-based practice. If I am looking at the systems-based practice milestone, the feedback that I have given about their technical skills will still appear, which is super confusing when you're looking at the systems-based practice and you're like, well, this has got to be an error. No, it's pulled from the EPA, which happens to be mapped to 6 to 8 milestones. So that is not an error, but it takes a little bit of understanding the mapping. So if you get that feedback or frustration from your CCC members, know that that's just that is a function of the mapping. We are also working to try and hide the feedback if it doesn't pertain, although that is a little bit of a bigger project. And can you pull a report just based on the suggested confidence? The suggested confidence should come up for every milestone rating, but you can't pull on that, if that answers the question. I'm going to move on now from this topic. I just saw one more question. Yes, so your CCC report saying no data found for selected date range. It may be that there hasn't been an EPA completed on that resident that maps to that particular milestone. And if that is true, that's what will come up. They only show for what is completed. That's correct. So if there hasn't been an EPA that maps to a particular milestone completed for that resident in the selected time frame, you will have no data. You will have no information. And it probably won't say all right, it has no data for no residents. That's an offline that's something we're going to have to take care of offline. So again, if you will reach out directly to Hethel or to EPAs at absurgery.org, we will work with you to get that, to figure out what the issue is there. Other questions about this, which is specifically related to, again, trying to make your lives easier so that you have a suggested milestone and essentially can ask, does anybody here think we need to have further discussion and need to move the milestone, suggested milestone up or down? That's where we hope to be able to give you enough information to get to. Which will shorten the discussion, hopefully shorten the discussion about assigning milestones in the CCCs. All right, I'm going to wait my 7 seconds to see if another question. Yep, there we go. Ooh. I don't know if there's a way to make that. That's an interesting question. That is an interesting question that I will take back about the standard. If something isn't completed, it just either is grade or so yes, that's an oh, whoops. Sorry. Oh, okay. So I'm going to move to sort of the next big, let's see if there's one more question here. Okay. Nope. I'm going to move to sort of the next next thing from a CCC standpoint. And this relates to what will ultimately be required of the graduating residents who are applying to take the qualifying exam. And that is, this will start in 2028. So you may think we're a long ways from 2028. I can tune out now. To get CCCs to start to think about what's coming, but also start to have them do some work that may help with, particularly with residents who are struggling. So on the left here is essentially what we're calling a worksheet. And it has each EPA and the phase of each EPA. I will, thank you, Ginny. There is a QR code at the end where you will have both the worksheet, which is on the left, and on the right are sort of the instructions for the worksheet. And again, if you have any questions about this, please reach out. Hethel gave you her direct email. You can feel free to email me as well. The emails at the ABS are not secret. It's just the first letter of your first name and then your last name at absurgery.org. And then we have the EPA email. So what we would like is for each of these phases for the CCC to take all of the EPAs that have been completed. So you have a resident who has 3, 5, 10, 15 EPAs that have been completed on abdominal wall hernia. And they're going to cluster around one of the 4 levels of entrustment. And what we would like you to do is put that level of entrustment in this summative entrustment worksheet. And you'll have some for preoperative, some for intraoperative, and some for postoperative. And then the CCC can say, for abdominal wall hernia, all 3 phases, how entrustable, given all of this information from the last 6 months, how entrustable do we think this resident is? And then the number of assessments and the number of raters, which will give you an idea of how confident, again, similar to the milestones, how confident you can be in this summative entrustment. And this goes down for each of the 18 EPAs. Where we think this will be helpful is if you have a resident that the discussion is that they're having a little trouble, you can point out which EPAs are demonstrating this. If you have blanks where you have no information, that's information that the program director can use to develop a learning plan. And if you have a resident who's at, say, the clinical PGY4 level, and most of the EPA information that's coming in is at a direct supervision level, Again, that really highlights with objective information that can be fed back to the resident and can be used to develop a learning plan, rather than you didn't do a very good job on your colorectal rotation. The faculty there had some concerns about your ability to counsel patients. There were some concerns about technical skills. Here it says that you are having difficulty with using your left hand laparoscopically, but there's also other information that says, well, they work hard. They did a really good job taking care of some of the complex post-operative patients and complications. So it gives a balance of information that is objective and can be fed to the residents. Ultimately, in 2028, what we will be asking of the applicants is to submit their overall entrustment for each of the 18 EPAs. And the program director will need to attest that that is, in fact, their level of overall summative entrustment. So by starting to do this now and getting in this habit every 6 months, it will give the CCC more objective information, but also give more objective information to the educational leadership team in terms of making the decision to advance residents to the next year, making the decision about performance improvement plans that may be necessary for some residents, and highlighting gaps. So here are Head will put the link, but here are the QR codes for each of these worksheets. This is the first iteration of the worksheet. It will likely change some, but the concept we feel is pretty solid in terms of information to both help the CCCs and moving in the direction that we will be requiring in 2028. Yes, absolutely. This is a form to start using now. And we are suggesting that it be used for every resident at every CCC meeting every 6 months. Now, that's a suggestion. Again, because we think it will be helpful. There may be some that you're like, we don't have enough information to do this. So just sort of a short, we are not interested in making work, and we have no oversight over the CCCs. But part of what informed the process in kind of developing the tools to get to where we are going to get to 2028 was my experience with our own CCC and some of the decisions that we didn't really have a lot of information on. We had the Gestalt from the CCC discussion and the faculty on the CCC. And we had some end of rotation evaluations that were not great, but they did not have very much actionable information. And so the hope is that by putting it in this worksheet form, particularly again for those who have either gaps where they're doing really well for hernia and gallbladder, but you really have no idea how well they are doing taking care of patients with breast disease or doing surgical consults. It will highlight some gaps that can be fed to the resident. Hey, while you're on this service, you need to really focus on these activities. And we'll make the decisions for those residents who are not doing as well go more smoothly because of the evidence that the EPAs and the subsequent worksheet allow. Yes, it is optional. It is absolutely optional. Again, one of the reasons to start now in 2025 is we don't want this to be a surprise in 2028. And so the hope is by giving you some information that hopefully will shorten the discussion about the milestones. Here's the suggested milestones for this particular resident. Do we need to adjust it up or down? Do we have any more information? Yes, let's talk about it. No, let's move on to the next one, to try to make that a little less overwhelming. And then you may decide, if you know there's a resident who you have a pretty good idea is in trouble, you may start by just using the worksheet for those residents that are in trouble. But there is no mandate. But we wanted to start early to give the tools to help develop behaviors and patterns, and so that we can get some feedback about the tool works, but if you did this, it would work better. So that's, and you absolutely decide at your own institution what's going to work in what order when you want to roll things out. So no, this is a this form would be completed prior to the CC. Well, that's an interesting question. This is the second great question you've had. The residents could fill out the number, and you could ask the residents to fill out how entrustable they think they are. All summative entrustment to be standard. You don't want the residents to be able to do that without educational leadership oversight. But absolutely, I hadn't thought about that. That's a really, and you might uncover a resident who has some insight problems. So, and then to answer the question, it's a count. So the you can download or you can get from Simple, when you look at a particular resident, you can see that they have this many EPAs from this many faculty, but the summative entrustment is has to be done by looking at the global aspect. And so that will never be a downloadable, because that takes they've had 2 that were direct supervision, they had 3 that were indirect supervision, and they had 1 that was practice ready. Am I going to come down on indirect supervision as summative? Am I going to say, because the most recent 2 were direct supervision, I'm going to come down on direct supervision? So that's always going to be a kind of a gestalt or a holistic decision, and that's never going to be downloadable. But you can get the number from Simple on the dashboards. So in 2028, the residents will be required to submit their summative entrustment for each EPA, and the program director will have to attest that that is accurate. And in 2028, they will have to submit summative entrustment for every EPA, and it can be any level of entrustment. It could be direct supervision for a graduating chief resident. It just has to be filled out, and has to be filled out accurately. Similar to the program director is going to have to attest to this, similar to the way they have to attest to everything else that the resident submits in their application. And that was done for really two reasons. We want the residents to become familiar with the use of EPAs to monitor their level of entrustment, their level of autonomy, their performance. So we want that to be a two-way conversation, and we don't want the process of application to our examination process. We don't want to take that out of the hands of the program directors. So that attestation and the fact that the residents, the applicants, fill out the entire rest of it. We wanted to mirror that process, and it will be similar. Yes, it will. I can almost guarantee it won't be exactly the same, but it will be similar, and definitely similar in concept. So right now, the board denies people admission to the examination process if they don't have some of the requirements: FLS, FES, total number of cases, ATLS certification. The exam, the application is not considered complete, and so it is denied until the application becomes complete. I anticipate that at some point, so in 2028, just have to submit an EPA profile, and this worksheet is the EPA profile. I anticipate that at some point there are going to be tighter restrictions, like the level of entrustability. And if the level of entrustability does not fall within what the examination committees decide, that may result in denial of application. But I would think about it in the exact same way as you can't take the qualifying exam if you have not taken and passed FLS, for instance, or if you have not taken ATLS, or if you don't have the correct number of, or you don't have the number of chief cases or the total cases. To information coming from the EPAs for the CCCs, the one related to suggested milestones, that although I know that the download is still a little clunky, we do hope that it will make your CCC discussions more efficient by providing you a suggested milestone. And then the worksheet previewing what will happen in 2028. That to get you used to that. So for large programs, my suggestion would be to we have a faculty that reviews each resident, and each faculty has 4 or 5 residents. I would have the faculty that presents that resident to the CCC complete the worksheet. If you were, or if we use Rachel's idea, I would have that faculty review the resident's completion of that worksheet. And then if the faculty could make the overall summative entrustment decision and only bring up for full discussion if they had questions. So that would be how I would do it in the large program. And if I were still program director for a large program, that is how I would have implemented that. And do we, the ABS, need the worksheet filled out historically for residents graduating that year? No, we don't. What we will need is the summative entrustment decision that is submitted by the resident, and then the program director attests to that. We will not be, just like we don't go back and look at milestones, we will not be auditing or any of that. And we do not have any EPA data that is specifically tied to any resident. And we don't, and we won't in the future. So that is all I have. Hopefully these have been up long enough so that anybody that wants to download them, I will stop sharing. And I'm happy if anybody has any more questions. Is this being recorded? I'm gonna have to look at Kylene and Barb. I think they said yes.
Yes. Barb was kind enough to record it for us, and she does post it. And I can't remember where. Barb?
I'll send you the link. It's in the, I have to remember where it's at as well.
I'll post the link, yes.
Okay, and I'm gonna ask Hethel about if there's a way to give class advisors, or if there's a way to give administrative access for a particular set of residents. That's a phenomenal idea. And if that is not, if that's not functional now, we will put that on the list, because I can definitely see how that that makes this easier. And then are they required to have an EPA for all 18 scenarios? They are required to submit a portfolio in 2028. If somebody says, I didn't get assessed, then in 2028, they're going to say, I didn't get assessed. But they are going to have to submit a portfolio that in summative entrustment. In 2029, I don't know what's going to happen. It would not surprise me that if the decision by the examination committee, which there are specialty boards for each of the specialties that are certified by the American Board of Surgery. And so the general surgery specialty board makes the decisions about general surgery requirements and examinations. So that's the body that decided about FLS and FES and decided which EPAs, how did the list of 18 get to be 18? That's the body that ultimately said yes to these 18. It would not surprise me that that they would make a decision that in 2029 and beyond, a level of entrustment was actually required. But just to be clear, that's not the case for 2028. So we started to say portfolio because we honestly, when we started this journey, we didn't know what it was going to look like. And this is kind of what we've come down with to try to make it a balance of meaningful, and although it may look daunting in terms of the number of rows to be filled in, ultimately, there's going to be a pretty good rhythm that will come with this. So the portfolio, you can look at the portfolio and the worksheet as fairly synonymous. There's not a discussion right now about adding EPAs. There is a discussion about when we are going to take a look at the data we have, and do we have the right EPAs? We're probably going to start that process in 2026, which will really be to develop the process and the people that are going to look at it. So I would not anticipate that the number of EPAs would change until about 2029-30. It sounds a little scary to be talking about changes that are going to happen in 2030, but there you go. And Joanna, you have absolutely nailed it in terms of that is definitely a goal number, because when you think about the micro assessments, so each evaluation that gets filled out, we're calling an EPA micro assessment. There's 18 EPAs, but each of them have at least 2, if not 3 phases. And so when you start to say, okay, that's about 51. Well, if we get 50 evals every 6 months, we're really only getting 1 per phase, and that's not really enough to make a summative judgment, because that's really just one person's opinion on one day with 1 case and 1 patient. So that's a very, very, very bare minimum. Yeah. Other questions?
Looks pretty quiet.
Well, thank you everybody for your questions and your engagement. That's really, it's really helpful, and your suggestions, because this has a tremendous amount of power in terms of giving you information about your residents and what they need at any individual or any point in time. And harnessing the big data is now what we need to help each other do collectively. As I said, I will be at Surgical Education Week, and we'll do a bit of a repeat of this, but also we'll add some things, some of the questions that you asked. We'll see if we can get some of the answers in there. And also, if you see me in the halls, just come up and grab me.
Well, thank you, both of you, so much. Oh, I see something in the chat. Certain procedures.
Yeah, so really good question that we didn't, so the every 6 months, the way that I have thought about this for the CCC that I participated in is if a resident became entrustable at the indirect supervision or practice ready level, and then didn't do a rotation, we'll use breast disease, and didn't do a rotation that had any patients with breast problems in the next 6 months, I would just copy the summative entrustment from the last 6 months and say 0 and 0, which is an indication that it's a carryover from the previous 6 months, because you don't really expect the resident to regress, although some do occasionally. But you didn't have any new information about that. And the same thing would be true if they had been entrustable at direct supervision and they just hadn't been exposed. But then you'd want to flag it, because you might want to adjust the rotations, as if you had a year, they'd been direct supervision, an entire year where they hadn't gotten any information, that should sort of ring a bell that we need to get them on a rotation where they're exposed to that particular disease process, so that we can make a decision about whether they're entrustable to care for patients with that disease process. Thank you for asking that. Appreciate it. And as per usual, the program administrators work harder than the program directors, because you've got about 3 or 4 times the number of people signed on here as the program directors. And I know that in previous years, we've been more in the evenings, and hopefully this is a little more helpful.
Yes, we greatly appreciate it. And we did get a good participant, so but we appreciate the information. I know I was unable to attend your first one through ABS, and so we appreciate it, because I know that a lot of people weren't able to. So, and I think you also have that recorded, correct?
That one is recorded. It provided some perspective from a couple of program directors who have been starting to use that. That's the one thing that I don't have here. But otherwise, the information is pretty similar.
Well, thank you to you both for coming. I really